Depression is a common condition affecting 1 in 5 Canadians at some point in their lives. Depression is a lot like other chronic diseases, like diabetes or heart disease, and you cannot simply snap out of it without treatment. It affects the brain, but it can also affect other body systems. A person who is depressed often has decreased immunity, meaning they have trouble fighting off infections, and they are more likely to catch a cold. Here. This shows what happens in the brain when a person is depressed. You can see here, there's less blood flowing to the brain in the depressed person, which is starving the brain from nutrients and oxygen, which is important to all body systems for proper function. This can cause symptoms like changes in emotions, fatigue, lack of motivation, and trouble focusing or concentrating, and even your ability to remember things. Does this make sense?
So something really is happening to me. This is real.
The brain has to be protected, just like we protect the heart. When we take blood pressure pills or when we take insulin for diabetes, you would agree that your brain is as important to you as your heart.
Yes, it is. I really need for things to pick up at work. I can't risk losing my job.
What you're saying is really important. I would feel the same way in your position. What I'm hearing is that feeling better and getting your focus at work back is very important for you right now. Is that a fair assessment of your goals?
Yes, that's exactly it. I'm tired of feeling down and not performing at work. My boss has been on my case, and I need to get back to normal.
Antidepressants work by helping to restore the right levels of chemicals in the brain. The sooner treatment is started, the better the chances of having a full recovery. I need to set up realistic expectations with her. Although she could start to feel better within a couple of weeks, she needs to know that she won't fully recover overnight. Now that we've covered how to take this medicine, we should also talk about what you can expect in terms of what it can and can't do for you. There are some important things you need to understand about antidepressant therapy. It could take up to 2 or 3 weeks for it to start to improve your symptoms. Everyone's different. It doesn't mean that this medicine isn't working. It just takes some time to feel the full effects. If your symptoms aren't noticeably better within 8 weeks, then we can talk to your doctor about trying a different antidepressant. There are lots of antidepressants to choose from, so if this one doesn't help, we can try another. We're here to help, but you have an important role to play in telling us if you're doing better or not. We're going to work on this together. You can always come back here if you have any questions or concerns, and you can also talk to your doctor. We're here to support. Does that make any sense to you?
But how will I know if I'm doing better or not?
That's a good question. Your doctor might use some questionnaires like this one to help track your progress. These types of questionnaires will help track the different symptoms of your depression and help evaluate the improvement in your mood, how it's affecting your body, such as your energy level, and lastly, how it's affecting your thinking, such as your memory or your ability to concentrate. Take these scales home with you and fill them up before your next appointment with your doctor. Or you can fill them up with your doctor during your first visit. Scales play an important part of your recovery as they will help you and your doctor track the progress you're making. Like many chronic illnesses, it can take time for you to fully recover from depression. So even if you're doing better, it's important to continue to take your medicine for at least 6 months. That will help prevent your depression from coming back.
I've heard that antidepressants are addictive and that they might damage my brain. I don't want to be on this forever.
I'm sensing that you're worried about taking this medicine for a long time.
Well, yes.
Let me reassure you that antidepressants are not considered addictive. For many people, taking an antidepressant is a temporary measure. Others need to continue taking an antidepressant for longer. Everybody's brain is different, and everybody's depression is different. So let's follow up regularly and make changes based on how you're doing. Does that sound okay?
Yes, that seems reasonable.
Like all medicines, antidepressants can have unwanted side effects. Some people who take this medicine may experience nausea, constipation, sweating, fatigue, sleep problems, dry mouth. These types of problems usually go away after a few weeks. But if you're bothered by any of these side effects, come and see me, and we can find ways to cope with these types of side effects. Does that seem like a good approach?